If you are trying to conceive and are feeling anxious, this video is for you. First thing you need to understand is how pregnancy really works. Even when a man and a woman are perfectly healthy and they have unprotected sex during a cycle, the chance of pregnancy is only about 20 to 25% per month. That is completely normal. Because of this, many healthy couples take 6 to 12 months of regular unprotected intercourse to conceive, and that is still considered normal. So, the first message is this: do not panic too early. Next, understanding your fertile window is important. Ovulation is the process where a matured egg is released from the ovary. This usually happens about 14 days before your next period. The most fertile time is about 2 to 3 days before ovulation and ovulation day itself. The egg survives for about 24 hours and sperm can survive inside the female body for up to 5 days. That overlapping window is when pregnancy is most likely to happen. During this time, having sex every alternate day is usually enough. Daily intercourse is fine too if you are comfortable, but more is not always better. Now, let's clear up some common misconceptions. Sexual positions do not affect your chances of getting pregnant. You don't need to lie down afterward. You don't need a pillow under your hips. And it is normal for some semen to leak out after intercourse. Also, female orgasm is wonderful, but it is not required for pregnancy to happen. All that is needed is a healthy sperm reaching the egg. Lubricants are another common question. If you use one, make sure it is fertility friendly, meaning it is water-based, glycerin-free, paraben-free, and fragrance-free. Many regular lubricants can reduce sperm movement. And remember, no pollution, tiny trick, or special method can guarantee the sex of the baby. It is always a 50-50 chance. Now, let's talk about preparing your body for pregnancy. Your overall health matters a lot. A diet rich in fresh fruits, vegetables, and whole grains has been shown to support fertility. These foods are rich in antioxidants, which protect egg and sperm quality. Highly processed and packaged foods, on the other hand, increase inflammation and oxidative stress, which can reduce fertility. Maintaining a healthy weight is also very important. Being overweight can increase the risk of hormonal imbalance, insulin resistance, PCOS, and thyroid problems, all of which can interfere with ovulation. Caffeine should be limited when trying to conceive. Up to 200 milligrams per day is considered safe. That is about 1 to 2 small cups of coffee. Remember, caffeine is also found in tea, energy drinks, soft drinks, and some supplements. Smoking is non-negotiable. It negatively affects both egg and sperm quality and should be stopped completely. Exercise is actually beneficial when trying to conceive. Moderate regular physical activity helps regulate hormones, improve insulin sensitivity, and support a healthy weight. You do not need to stop exercising, just avoid extremes. Consistency matters more than intensity. Now, one of the most overlooked steps is preconception counseling. Before trying to conceive, it is important to see a healthcare provider. This visit helps review your menstrual history, identify fertile days, and screen for conditions like diabetes, thyroid disorders, or hypertension. Basic tests may include blood counts, thyroid test, blood sugar test, infection screening, and sometimes an ultrasound or pap smear if due. Getting these things addressed before pregnancy can make a big difference. Prenatal vitamins are also important. Every woman planning pregnancy should take folic acid ideally 3 months before conception. Folic acid helps prevent serious birth defects of the baby's brain and spine. Also, vitamin D, iron, and other micronutrients may also be recommended, but avoid self-medication. Always follow proper dosing and medical advice. Finally, let's talk about stress. Stress is one of the biggest hidden causes of infertility today. It affects hormone release from the brain and can interfere with ovulation and implantation. Find ways to manage stress, whether it is exercise, meditation, breathing exercise, prayer, or spending time with loved ones. And remember, the stress of trying too hard can also work against you. Getting pregnant was never meant to be this complicated, but modern lifestyles have made it harder for many people. If you found this video helpful, please like, share, and subscribe. And until next time, stay healthy and be kind to yourself.